Hello, my name is Aisha Aden. I'm a second-year medical student at Mayo, and I'll be presenting my poster on promoting inclusivity in surgical attire and scrubbing protocols. We were inspired to write the guide that this poster is based on in response to challenges students face during surgical skills training. Factors like religious head coverings and natural or protective hairstyles may necessitate attire modifications for individuals to practice PPE safely and comfortably in the OR and ICU. Historically, there's not been any literature outlining these accommodative measures for learners to access. Instead, they often resort to seeking out healthcare professionals with similar religious or ethnic backgrounds for advice. We sought to address this gap by compiling these tips and tricks into a guide for learners and educators to use. Religious head coverings, such as hijab, dastars, turbans, and tickles, can be contained within a number of options, including a surgical scrub cap, a surgical bouffant, or a surgical hood, depending on the amount of coverage one desires. For those who would like coverage over the neck and chest, a surgical hood is a great option. It can be worn over head coverings and tightened to contain all materials underneath, as depicted in Figure 1. For those who seek only to cover their head but would like more opacity, a surgical bouffant can be worn beneath a surgical cap for better coverage. The polypropylene material of disposable head coverings can be harsh and drying to natural and textured hair. To overcome this, one can wear a home-laundered silk or cotton-lined bouffant underneath disposable head coverings so long as they are fully contained. Individuals with voluminous hairstyles can find it difficult to fully support their hair within disposable head coverings. This too may be addressed by wearing a home-laundered bouffant beneath the hospital-provided disposable head covering. Medical professionals working in the ICUs who kept their beards during the COVID pandemic noted that their facial hair interfered with their wearing N95 masks. Hair disrupts the seal of this mask, so bearded medical professionals couldn't pass N95 fit testing. Pappers, as depicted in Figure 3, are an alternative for bearded medical professionals to wear in the ICU and are exceedingly effective at respiratory protection from airborne particle transmission. The most robust evidence-based guideline currently available for surgical and ICU attire recommendations is produced by the Association of Perioperative Registered Nurses, or the AORN. In response to our guide, the AORN updated its guidelines to better address religious head coverings in the OR and ICU, in which they stated, religious head coverings that are clean, constructed of tightly woven and low-linting material, are without adornments, and fit securely with loose ends tucked in the scrub top may be worn to cover the hair and scalp in the semi-restricted and restricted area. In the past, the information we covered was shared anecdotally, or from people students were referred to for guidance. Just speaking from my own experience, I was not aware of the resources, specifically all the various types of PPE available for us to use. This guide has been shared with the Department of Surgery at our institution and is available to all students during surgical skills training. It is our hope that all learners have equal access to this information and, in addition to this, are able to turn to any member of the surgical team for help or advice. We recognize that our guide is not entirely comprehensive. It is our hope that it too can be updated as needed to better reflect a diversifying workforce. We hope to empower learners, especially those who may not have access to professionals from similar racial, religious, or ethnic backgrounds, to pursue experiences and opportunities in procedural and surgical fields. Thank you for listening.